Hello, and welcome to this edition of Oncology Data Advisor's coverage of the Oncology Nursing Society ONS Congress 2025. In honor of Oncology Nursing Month this May, we sat down to speak with Eileen Hacker, who is a professor and chair of the Department of Nursing at the University of Texas MD Anderson Cancer Center, about her presentation regarding the progress and impact achieved from the University of Texas MD Anderson Cancer Center's Argyros Postdoctoral Research Fellowship in Oncology Nursing. Thank you so much for joining us today, Dr. Hacker. We are so excited to have you and hear about your presentation. Would you like to begin with introducing yourself and what you do?
Thank you so much for having me here today. We were really excited to do our presentation at the Oncology Nursing Society's annual Congress. And the purpose of our presentation was really to describe the progress and the impact of our postdoctoral research fellowship program on advancing nursing science in a comprehensive cancer center, and really to talk about using philanthropic funds to support oncology nurse scientist development.
Terrific. We're excited to hear more about it. So, to begin, would you like to give us a brief overview of your presentation and why you're addressing the challenge of declining nurse PhD programs and enrollment?
Sure. So the sustainability and future of nursing science really requires a commitment to education and training, research and evidence-based practice, integrating technology into our practice, as well as considering policy and advocacy as to advance oncology nursing science and clinical practice. And the pathway to becoming a nurse scientist really begins with the completion of the requirements for a PhD program. We are currently experiencing declining enrollment in nursing PhD programs, and we're also faced with an emerging faculty shortage that threatens the long-term sustainability of our discipline-specific science. So, according to the American Academy of Nurses, enrollment in PhD programs from 2013 to 2023 declined by 17.5%. And so, there's a number of factors that contribute to this, including aging of the faculty, an expected wave of retirements over the next generation, and quite frankly, higher salaries in the clinical arena as well as in industry. And so, one critically important strategy to fuel the oncology nurse scientist pipeline is through oncology nursing research postdoctoral fellowships. And so that's what we're trying to do here at MD Anderson with our Argyros Postdoctoral Research Fellowship in Oncology Nurses. So fellowships help our future scientists extend the knowledge of the discipline, they expand the fellows' area of research expertise, and most importantly, it allows the fellows to build the necessary research skills to launch an independent research career that then provides the evidence for our clinical practice.
Why are programs like the Arduous Postdoctoral Research Fellowship in Oncology Nursing not only important to nursing education, but also important for the future of oncology nursing research and training as a whole?
Well, first, um, when we think about nursing is a clinical discipline. It's a practice discipline. And so the vast majority of nurses are really providing direct patient care at the bedside. And our practice needs to be based on evidence. And that evidence comes from research. And the research is conducted by the nurse scientists. So it really is a very nice circle that we have scientists. Our research is informed by the people at the bedside providing the care that really identify important problems to be studied, and as well by advanced practice nurses. And then the nurse scientists then take those problems, turn it into a researchable question, and then develop the evidence. And then hopefully we translate that evidence back into practice. So you can see it's a nice circle, and we really close the loop when we engage all nurses in this type of scholarly endeavor.
Awesome. And what are some of the challenges that you experienced in creating this fellowship and throughout its first 3 years?
Well, first, I think it's really critically important that we thank the Argyros Family Foundation for their very generous gift and their foresight to really be able to support a postdoctoral research fellowship in oncology nursing. Our first order of business, though, was to generate interest among doctoral students and those close to completing their PhD in nursing or nursing science. And this really required formal and informal approaches. As you can imagine, posting on a website, and the MD Anderson website in particular, posting on other websites, American Association of Colleges of Nursing, sending official communications to deans, associate deans of research, directors of PhD programs to share information about the program. This was all part of getting the word out there. But equally important was our boots on the ground approach, which was communicating and networking with colleagues across the nation at all the various meetings that we attend. So myself and then other faculty in the Department of Nursing. Um, some of the initial challenges was we were organizing the program from scratch. Now, thankfully, I've been in academia for a while, so I know a little bit about postdoctoral research programs. And so really, we wanted to organize a program from initiating our nursing research grand rounds, nursing research journal club, where we really do deep dives into the methodologies of various research studies, to critique and really to gain a better understanding of the science and the methods that are used to answer those specific research questions. We developed our postdoctoral seminar series. We have one-on-one mentorship and dovetailing our programs with the offerings from the Office of Postdoctoral Fellows under Research, Education, and Training here at MD Anderson. So we had a lot of support, but we are primarily focused on discipline-specific knowledge, as well as how can we engage with other scientists to actually bring together teams to answer really critically important questions. But knowing that what we bring as neuroscientists to the table is our understanding of the patient experience as a whole and the integration of the patient into their family unit, into their community, and understanding the biopsychosocial aspects of the individual along with their families and communities. And that's what we as neuroscientists bring to the table.
Definitely, it's such an exciting endeavor
Yes.
to learn about and hear more about. So, if you don't mind me asking, at ONS this year, what were some of the results you were able to present?
Well, so our postdoctoral research program has been in existence for 3 years now. I joined MD Anderson in May of 2022, and we officially launched all the pieces of the program that I told you about just a few minutes ago in September of 2022. So well, first of all, we have wonderful fellows, highly intelligent, compassionate nurses, hardworking, that really have a stellar career ahead of them. I am confident that they all will make significant contributions to nursing science and clinical practice. So in the 3 years, almost 3 years, our first postdoctoral research fellow, Dr. Anju Choi, received a highly competitive NIH grant, which is a K99 R00, which is a career development grant, first part, and then an independent research study in the second piece of the grant. Our second postdoc actually received a highly competitive grant from Sigma Theta Tau, a small grant, but these are also highly competitive. They are publishing and disseminating their findings in multiple venues. They have published the 3 postdoctoral fellows that we have right now. We have Dr. Karen Alsbrook, who's in her 3rd year, Dr. Anju Choi, and then Dr. Gisele Toulousti, who's in her 1st year. Together, these 3 individuals thus far have published 27 manuscripts. They've disseminated their findings at 11 national and international conferences. They all have won awards. Dr. Anju Choi was selected as the Cancer Prevention and Population Sciences Postdoctoral Research Fellow of the Year. Dr. Karen Alsbrook received a People's Choice Award for her poster looking at opiophobia in post-surgical patients. And then Gisele Toulousti just received an award from the American Society for Transplantation and Cellular Therapy, the nursing section. She received second place for her abstract related to a physical activity program in hematopoietic cell transplantation survivors. The presentation was based on her dissertation work. So they really are stellar, and I expect them to do great things in the future. So excited. As a mentor, I learn as much from them as I hope I'm able to share with them. So it's a great partnership, and we really hope to be able to continue this type of program. It's really critical to the sustainability of nursing science.
Wow, yeah, that's incredible. And congratulations to not only the program success, but the success of everybody that has been going through it. So that's amazing to hear. Next question I wanted to ask you is, are there any plans to continue this research or create more philanthropic funded postdoctoral research fellowships like this one?
Well, I'll tell you, I sure hope so, which is part of the reason why I'm so happy to do this interview. The Argyros Family Foundation is incredibly generous with us to be able to provide not only the funds for the postdoctoral program, and we will have our fourth postdoctoral research fellow starting in September. Also, I expect great things from her. So we certainly hope that we will be able to continue this program we received our generous gift from the Argyros Family Foundation, and that we will finish the funding of that gift probably in 2027. We're certainly hoping that we would be able to continue this program. I know that there are many donors out there who are looking for ways to contribute to society. In nursing, we are the most trusted profession, and have been for many years. And this kind of program really helps keep nursing alive and the practice based on evidence. So we certainly are hoping to be able to continue that. The other reason why we did the presentation at the Oncology Nurse Society Congress is to help other organizations think about using philanthropic funding to support a postdoctoral research fellowship. Most fellowships are supported internally or through an NIH grant that supports pre and postdoctoral fellows. This is one of the first that I've heard of a philanthropic foundation supporting it.
Terrific. And is there anything else you feel is important to mention about your presentation or this program that you would like to mention to our audience?
Sure. Nursing, as I've said several times in this interview, is a practice discipline, and our practice needs to be based on the best available evidence to promote high quality care and patient outcomes. So the evidence is based on the research generated by nurse scientists. And many people will ask, what is nursing science? So this is my definition of nursing science. It is the discovery and advancement of knowledge that optimizes health and promotes well-being throughout the lifespan to address vital health needs wherever nursing care is provided. So I am a lifelong oncology nurse, and it is an honor and a privilege to serve our patients, their families, and the communities. Everything that we do as nurses, as oncology nurses, whether it's in research, education, clinical practice, eventually should boil down to improving the quality of those that we serve. And that's the story that I wanted to bring to your audience and to our audience, and help people to understand that really what we want to do is improve patients' quality of life. And nurses are uniquely qualified to do that given our education and training.
Final question I want to ask, since May is Oncology Nursing Month, are there any messages you'd like to share regarding the importance of oncology nursing science and how to build a sustainable future, besides all the amazing information you've already provided us?
Yeah, I think my last statement probably sums it up best, that it really is an honor and a privilege for us to serve. Oncology, when somebody is diagnosed with cancer, it is obviously a very difficult time in that individual's life journey. And they privilege us by allowing us to be a part of their lives. And so when I say it is an honor and a privilege to serve them, to serve the patients, their families, and their communities, I truly mean that from the bottom of my heart. We are a service profession, and everything we do should really boil down to improving the quality of their life, optimizing their health, promoting well-being, and improving the quality of their life, whether it's through the cancer treatment process, whether it's through survivorship, diagnosis, or unfortunately, at the end of life. But we are here to serve as nurses, and it's a privilege to do so. So thank you for asking that question.
No, thank you so much, Dr. Hacker. It's been a privilege to be able to hear about your research and your passion. So thank you so much for your time today. And we look forward to hearing more about what your program brings in the future.
Well, thank you so much. Thank you for spreading the word about our program.